Good afternoon, everyone. My name is Cassandra Taylor, and I am the founder and CEO of Top Flight Defense Incorporated. And today we are going to have a session on cervical care awareness because January is Cervical Care Awareness Month. And today we have Ms. Dolly Masters from the Captain James Lovell VA Hospital. And thank you, Dolly, for coming out. And if you would do your intro and let everyone know who you are and what it is that you do.
Hi, everyone. Thanks for coming on. I am Dolly Lemaster, as Cassandra had stated, and I am the Women's Healthcare Coordinator as well as the Maternity Care Coordinator here at Lovell. We service our veterans as well as our active duty Department of Defense military members as well. And I welcome you all. As Cassandra said, January is Cervical Cancer Awareness Month. The new year is here, and the VA is reminding veterans that January is Cervical Cancer Awareness Month. It's a great time to raise awareness about cervical health and the importance of getting regular screenings. So I'm going to share with you right now a PowerPoint regarding this, and if you can just follow along, and I'll be speaking as those PowerPoints come up. And cervical screening. What is cancer? This is a very simple chart here that shows our normal cells, abnormal cells, abnormal cells multiplying, and a malignant or invasive cancer. Can everyone see those slides? Okay. Cancer is a disease of the cells, which are the body's basic building blocks. The body constantly makes new cells to help us grow and then the worn out tissue and heal. Sometimes these cells do not grow, divide, and die in the usual way. And this may cause abnormal cells to multiply. The chances that that this develops in a tumor or organ is called primary cancer. And then the earlier cancer is detected and treated before it can spread to other parts of the body, the better chances of survival. And that's when we do our preventive screening. This one today is going to be the cervical cancer screening, which all women should do. Cervical cancer, it is one of the most preventable cancers there are. As I said before, cervical cancer is the growth of abnormal cells. The cervix is between the uterus and then the vagina. So it'll be just right here. As you can see right here, that is your cervix. That's where they go up in and then we scrape those cells. Okay? Cervical cancer may not show symptoms at all. If the symptoms are present, they usually include vaginal bleeding between your periods after menopause or during or after sexual intercourse. You sometimes can have pain during sexual intercourse, an unusual vaginal discharge, or even heavier periods or periods that last longer than usual. If these symptoms persist, they can be also caused by other conditions. That is when you call your primary care provider right away and try to get them to be seen. Human papillomavirus, which is called HPV for short. Over 99% of the cervical cancer is caused by HPV. What is it really commonly called? It's the common cold of sexual activity. And it usually has no symptoms at all. It is spread by genital skin to skin contact during sexual activity. And as mentioned before, it usually doesn't have any symptoms at all. And most infections go away by themselves. We now know that HPV causes 99% of the cervical cancers. So what happens with that Pap test, it also includes, if they include it now, an HPV test. This is the data, as you can see here. This is the spectrum of HPV-related cancers. We have the first one, cervix, 99%, as I mentioned previously. The anus is 84.3, vagina 69.9, the penis is 47, the vulva, which is a part of our outer vagina, that's 40.4%. The oral pharynx 35.6, and the oral cavity 22.5. These last two are our oral cavity. There are 120 different types of general HPV. 15 are linked to the cancer. It also causes genital warts. This type of HPV that causes the warts is not the same as the type that causes the cancer. And as you can see, as I discussed, those are the other cancer. So let's get these out and we'll continue. Sorry about that beeping. This is the HPV vaccine. Usually it is free to girls and boys. They start, it shows here 12 to 13. I'm hearing as early as 9. And usually when they say free, that is really considered under your insurance as preventive. Insurance usually pays for preventive, 100% of preventive screening. So they should pay for that as 100%. That vaccine fights 90% of HPV-related disease, and the vaccine is safe. But like I said, it starts at 9 years old, the earliest, and it goes up to 45 years old. I did speak to our gynecologist nurse practitioner, and she said sometimes they might go up a little bit over 45, so maybe if you're 46, discuss that with the primary care provider, and they can still possibly give you that HPV vaccine. Here it just shows little kids, all different types, getting ready for the vaccine. Cervical screening. Even if you've had the HPV vaccine, regular cervical screening is the best protection against cervical cancer. That vaccine doesn't protect. It doesn't protect against all strains of HPV. Screening is testing for the disease before the symptoms occur. Screening tests can find diseases early when they're easier then to treat. Screening is for people with no symptoms. Screening is not testing for cancer, like I said, but it looks for the early signs of cancer. So then treatment is still available, and that is the cervical screening. If your screening test is positive, it doesn't mean you have cancer. We know 80% of cervical cancers occurs in women who have never screened or don't screen regularly. Okay, what's the myths about the cervical screening? There are many reasons why women still don't want to get screened. They fear of detecting the cancer. I don't want to know. They have a stigma or shame that gets associated with the cancer, thinking that a cancer is a death sentence. The lack of knowledge, because some people don't know. And what we don't know, we're usually afraid of. Negative past medical experiences. Maybe any one of you might have gone to a provider and in the situation at that time, really nice. Well, you can always ask for a provider or go at another time. Maybe you were not feeling well or apprehensive about the exam. Just reschedule, but it is important that you do get the screening done. Yeah, and that's what I was going to. You can ask for a chaperone, a female chaperone, to be with that provider, whether that provider is he or she. Do that. It is a reassurance for you when you get these preventive screenings done. Also, it could be lack of time. Oh, I don't have time for that. I go in to see the primary care doctor. I don't have time for screening, and then you want to maybe schedule it later. Guess what happens? You forget to do that. So there are many myths that we have, but it is one of the most preventable cancers that we can get. Not be exposed to when we get these screenings done. The screening test. Research shows waiting 5 years between tests is very safe. Now that's up to your provider. Most of the time, if you keep on having negative screenings with the The cervical cancer screening and the HPV screening, because that is two separate tests, but they're combined, usually that can go for 5 years. But of course, that is between you and your provider. Most, like I said before in another slide, most HPV infections are cleared by the body naturally. And it can take decades for HPV infection to develop into cervical cancer. Most of them, the screening tests start about 25. 25 is a safe age, but the changes in guidelines are based on a lot of evidence and new technology, so those ages might change over time. Cervical cancer in women below the age of 25 is extremely rare. But like I said before, the HPV vaccines, more people are protected from HPV. Women will receive, usually you get an invite to do your annual exam. That's when you can discuss with your primary care provider to say, hey, I'm not sure when my last pap smear was, but I think I'm due for one. Okay? And as I said here, people with a cervix age 25 to 74 need to have a cervical screening test, even if they had to have the HPV vaccine before, have only one sexual partner, you've been through menopause, have experienced traditional cutting or circumcision, that's usually with the male, have sex with female partners, are divorced or widowed, and have a disability. Still get this screening done. It is vital. And that's when we talked about the interval, when you can really be screened. Like I said, you could start at 25. It can even be start earlier. If a young woman is experiencing some discharge or something, they might want to do a cervical screening, but mostly it is at age 25. And that's where it is that 25 safe? Yes, it is. It's very rare. Like I said before, it's not really detected at 25, but it can happen. And here are some key messages. Cervical cancer is one of the most preventable cancers. Cervical cancer can be prevented through regular screening tests. Like I said, most of the time it is yearly, then it goes to 3 years, and then it goes to 5 years. It depends upon your negative or positive test in the past, and then what your primary care provider recommends. Cervical screening is important for all people with a cervix. Cervical screening should be done every 5 years. Like I said, that 5 years can change. If you consistently have the HPV test with the cervical cancer screening test, and it's negative, usually it will be 5. Okay? Another key message, of course, take care of your health for your family by getting screened for cervical cancer. Thank you. That's my presentation. And then I just want to bring up another thing real quick. This is our information sheet that is presented to our patients here, even though it reads for the HPV 4 things a parent needs to know. This is what they give you because it pertains to the HPV vaccine, which can be given to women, like I said, up to 45, but it can in instances go up to maybe 46, depending upon what the provider wants to do. And how these HPV can be serious. HPV can cause certain precancers and other diseases. HPV affects both genders. Like I said before, you can't tell if someone has HPV. And there really is no treatment for HPV infection, but getting regular screenings are important regarding your cervix. And this is another part of that information. Approximately 14 million people will become newly infected each year, and about 50% of new infections occur in 15 to 24-year-olds. This is the HPV now. Each day in the United States, women are diagnosed with HPV-related cervical cancer, 33 women every day. HPV-related cancers are, as I said before, the anal cancer, genital warts, cervical cancer, vulvar, and vagina. And then every hour, there is an estimated 40 new cases of genital warts. And this is where that HPV vaccine comes in handy. quickly show you, this is the actual guidelines right from ACOG, which is the Association for Gynecological Recommendations. I'm going to put this, if you can see, can everyone see the ages in that? If you are younger than 21, you do not need screening. 21 to 29 have a pap test alone every 3 years. HPV tests alone can be considered for women who are 25 to 29, but the pap tests are preferred. When you're 30 to 65, you can choose one of these options. Have a pap test and an HPV test every 5 years, like I was telling you. Or you have a pap test alone every 3 years, have an HPV test alone every 5 years. Of course, the most important thing is to discuss everything with your primary care provider. Everyone is individual. Everyone has their own body. And of course, these are the exceptions to the guidelines. You might have the HPV more frequently, then you need more frequent screening. If you had a hysterectomy in which your cervix is removed, and you have a history of cervical cancer or moderate to severe cervical changes, continue to have screenings for 20 years after your surgery. Now, that of course is contingent upon what your provider designates. Let's see, anything else? And of course, you know how to contact your primary care provider. Just call them up, say you're due for your annual exam. Tell them, I think it's been a while since I had my cervical cancer screening. Can I get that done? And they can look at your last results, and unless you're starting. And let's see if there's anything else. I think that's it. Now I can just take your questions.
Okay, well, if that's the end of your presentation, let me say thank you first, and then I will turn off the recording. And I thank you so much for coming in and coming out and doing this presentation for us so that we can be more aware of our bodies. Thank you.
You're welcome. And remember, preventive